In this podcast episode, Dr. Mark Hyman discusses the alarming state of America's health, the food system, and the pharmaceutical industry. He emphasizes the urgent need for change in how we approach nutrition and healthcare. Dr. Hyman begins by addressing the healthcare crisis in America, highlighting the staggering costs associated with healthcare, which have ballooned to nearly $5 trillion. He points out that a significant portion of these costs, around 80%, is linked to preventable chronic diseases. This alarming statistic underscores the inefficiency of the current healthcare system, which often focuses on treating symptoms rather than addressing root causes. Dr. Hyman argues that the conversation around healthcare has historically been limited to discussions about entitlements and insurance, neglecting the fundamental issues driving the chronic disease epidemic. He believes that America is at a pivotal moment where the public is beginning to recognize detrimental effects of the food system on health. The metaphor of the frog in boiling water is used to illustrate how society has gradually accepted worsening health outcomes without questioning the underlying causes. Dr. Hyman asserts that the time has come to confront these issues head-on and advocate for a healthier future. As a functional medicine doctor, Dr. Hyman emphasizes the importance of understanding the root causes of health issues, particularly those related to diet. He shares a personal anecdote about a diabetic patient, illustrating that diabetes cannot be cured in a doctor's office, but rather through changes in diet and lifestyle. He argues that the food system is a significant contributor to chronic diseases, and the way food is produced and marketed plays a crucial role in public health. Dr. Hyman explains that the current food system is driven by industrial agriculture, which prioritizes commodity crops like corn, wheat, and soy. These crops are often transformed into ultra-processed foods that lack nutritional value and contribute to health problems. He stresses that the solution lies in addressing the food system from field to fork, advocating for policies that promote healthier food production and consumption. The conversation shifts to the dangers of ultra-processed foods, which Dr. Hyman describes as chemical science projects that do not nourish the body. He cites research indicating that ultra-processed foods are now the leading cause of death globally, surpassing smoking. Dr. Hyman argues that these foods are engineered to be addictive, leading to overeating and a host of health issues, including obesity, diabetes, and heart disease. He highlights the alarming statistic that 67% of the food available in grocery stores is ultra-processed. This prevalence of unhealthy food options makes it increasingly difficult for individuals to make healthy choices. Dr. Hyman calls for greater transparency in food labeling, urging consumers to be informed about what they are eating and to avoid products with long, unrecognizable ingredient lists. Dr. Hyman discusses the direct link between diet and chronic diseases, emphasizing that many conditions, such as heart disease, cancer, and diabetes, are preventable through dietary changes. He points out that the rise in chronic diseases over the past few decades correlates with the increased consumption of ultra-processed foods. The statistics are staggering. Obesity rates have skyrocketed, and chronic diseases are affecting younger populations at alarming rates. He argues that the healthcare system's focus on pharmaceuticals and treatments for these diseases is misguided. Instead, Dr. Hyman advocates for a shift towards preventive care that prioritizes nutrition and lifestyle changes. He believes that addressing the root causes of chronic diseases through diet can significantly reduce healthcare costs and improve overall public health. The discussion then turns to the pharmaceutical industry, which Dr. Hyman criticizes for profiting from the chronic disease epidemic. He argues that the current healthcare system is designed to treat symptoms rather than prevent diseases, leading to a cycle of dependency on medications. Dr. Hyman highlights the irony that while the pharmaceutical industry profits from treating chronic diseases, the root causes, largely related to diet and lifestyle, remain unaddressed. He emphasizes that the focus should be on prevention and education rather than solely on medication. Dr. Hyman believes that the healthcare system should prioritize lifestyle interventions that can effectively reverse chronic diseases rather than relying on pharmaceuticals that often come with side effects and long-term consequences. Dr. Hyman stresses the need for better nutrition education within the healthcare system. He points out that many medical schools do not provide adequate training on nutrition, leaving doctors ill-equipped to advise patients on dietary changes. He argues that this lack of education contributes to the ongoing health crisis, as healthcare providers are unable to offer effective solutions for preventing and reversing chronic diseases. He advocates for a comprehensive approach to nutrition education that includes training for healthcare professionals, as well as public awareness campaigns to inform the general population about the importance of healthy eating. Dr. Hyman believes that empowering individuals with knowledge about nutrition can lead to significant improvements in public health. The conversation also touches on the role of marketing in shaping food choices, particularly among children. Dr. Hyman highlights the aggressive marketing tactics used by the food industry to promote unhealthy products, often targeting vulnerable populations. He cites the staggering amount of money spent on marketing junk food to children, which contributes to poor dietary habits and rising obesity rates. He argues that the government should take action to regulate food marketing, particularly to children, in order to protect public health. Dr. Hyman believes that by limiting the exposure of children to unhealthy food advertisements, we can help foster healthier eating habits from a young age. Dr. Hyman calls for significant policy changes to address the issues within the food and healthcare systems. He emphasizes the importance of government intervention in promoting healthier food options and supporting sustainable agricultural practices. Dr. Hyman believes that the government has a responsibility to protect public health and should prioritize policies that encourage healthy eating and prevent chronic diseases. He discusses the potential for reforming programs like SNAP, Supplemental Nutrition Assistance Program, to ensure that low-income individuals have access to healthy food options. Dr. Hyman argues that by investing in nutrition and preventive care, the government can save money in the long run by reducing healthcare costs associated with chronic diseases. While Dr. Hyman emphasizes the importance of systemic change, he also acknowledges the role of personal responsibility in making healthier choices. He believes that individuals must take an active role in their health by educating themselves about nutrition and making informed decisions about what they eat. Dr. Hyman encourages people to be proactive in seeking out healthy food options and to prioritize their well-being. He recognizes that changing dietary habits can be challenging, but he believes that with the right support and resources, individuals can successfully improve their health. Dr. Hyman advocates for community-based initiatives that promote healthy eating and provide resources for individuals looking to make positive changes in their lives. As the podcast concludes, Dr. Hyman expresses optimism about the future of healthcare in America. He believes that there is a growing awareness of the need for change and that the public is ready to embrace a new approach to health and wellness. Dr. Hyman envisions a healthcare system that prioritizes prevention, nutrition, and lifestyle changes, ultimately leading to better health outcomes for all. He encourages listeners to stay informed and engaged in the conversation about health and nutrition, emphasizing that collective action is necessary to drive meaningful change. Dr. Hyman believes that by working together, we can create a healthier future for ourselves and future generations.